Annie, thank you so much for joining me today. Welcome to the show.
Thank you for having me. I'm excited to be here.
I'm excited to have this conversation with you today because I, for one, don't know a whole lot about Montessori because I don't have kids. I don't work with kids, and I've just heard a lot about it. I feel like when we were growing up, it was this whole big thing and then kind of phased out for a while, and now it's kind of coming back. And I've seen bits and pieces of it attached to dementia over the last couple of years. And so I'm really excited to learn from you today.
Yeah, thank you. Yeah, thank you for having me. I'm excited to be here. I'm excited to definitely talk about the approach and just my perspective on it.
Awesome. Well, Annie, we had a chance to chat a while back, and you shared your extensive background in working with children, elders, the Montessori approach, kind of the whole thing. So go ahead and introduce yourself for our audience.
Yeah. Well, again, I'm Annie, and I'm the founder of Monte Bloom, and I just have a passion for supporting caregivers and their loved ones through Montessori approaches in dementia care. I have over a decade of experience working in the dementia field. I've served in various roles, such as being a certified nurse assistant, activities assistant, and then transitioning into leadership positions, such as clinical quality care. And the one role I'll probably talk the most about is being a director for an adult day, which was attached to a preschool. And so all of this kind of led me to where we are today.
That's awesome. I've definitely seen a lot more coming out from like Europe and Canada and Australia. The US always tends to be about 5 years behind schedule.
Yeah. Yes.
But I've seen a lot about developing programs around like even in senior living homes and communities where they add a daycare to the community. And just that, like, I guess that human approach between children and elders and how them interacting can be so beneficial for both of them, right?
Oh, yes. Yes. It's definitely an easy, when I say with caregivers, like everyone's benefiting. So even with the center, it was respite care. So dropping someone off, everyone's, they're getting time away from their loved ones so they can reflect on their mental health and just having time for themselves. And they know that they're getting, having fun and getting purposeful engagement, with kids interacting with them. And so they feel like a volunteer and a teacher, and it's fulfilling that purpose.
Yeah, absolutely. So you mentioned you started out as a CNA, I think, right? And then you kind of developed into all these different roles and ultimately getting into this adult day with preschools kind of situation.
Yeah. So in my bachelor's program, I was a CNA and activities assistant, and I stayed a CNA and activities assistant through my master's. And that's where I worked primarily with the same age group. And one of the biggest things that I saw was loneliness and lack of purpose within the age group. And it's very hard to sometimes think of activities when you're in these facilities. Then after my master's program, I had an opportunity to work at an intergenerational center where it was a grassroots nonprofit, and it was an adult day, but it was attached to a preschool in one building. And you ate and did activities together, but we called the residents who participated in this adult day volunteers. So their loved ones dropped them off, and they spent how many hours? It was either a full day or a half day, and they either were in the classrooms, they helped plan activities, they did story time, they helped with nap time, we did family eating, and all of that was just cohesive together. And it allowed the caregivers to also get that respite they needed. And everyone's feeling good about it. The loved one felt happy to go into an adult day setting, but they believed that they were going into a school, and they were to help, us teach and take care of the kids. So it was beneficial for both. It was very easy to get people involved in the program.
I love the purposeful engagement piece of this because as an occupational therapist, that is kind of our bread and butter. We love anything that kind of facilitates that. With the older adults who would come in and help, though, were there requirements as far as their like physical function or cognitive function, and like how did you kind of, I guess, allow or facilitate varying strengths,
Yeah.
to utilize them effectively with the children?
So the biggest thing with Montessori that you'll hear, even with the children Montessori, is focusing on abilities. And that's especially when it comes to dementia care. We have people from all abilities, so being able to assess them and make that individualized care plan. If you're in a nursing background, you probably hear about care plans and personalized care. And that's kind of what it was in this building. So some people were able to really engage in the rooms longer than others, and yet to meet them where they were at, with both groups, with kids and with the persons with dementia. But eventually, if someone progressed enough where the noise and the sounds, they might have stayed in the adult day wing, and we were bringing a kid or a baby for one activity, and it was more of a one-on-one. So it's really just meeting them where they're at with the abilities, because the purpose of Montessori is, to give that someone purpose and to engage and to, be involved in their community. But it's also to not to decrease challenging behaviors and agitation, and giving someone a task that is above their abilities is only going to add to the agitation and the behaviors that you're trying to reduce. So it's really important to always be assessing the environment and the ever-changing needs of both groups to make sure everyone's able to participate in the activity before they start getting agitated.
Yeah, I'm going to backtrack a little bit for a second because you kind of started explaining this already. But for those of us, me included, who are not familiar with Montessori, can you define or provide an overview of the Montessori philosophy and the approach and kind of how it works?
Yeah, so the Montessori approach is it's really focusing on that independence, the respect, autonomy, choice, and making an environment that's fit for them, and really focusing right on those abilities. And with dementia, it looks a little different in some areas and how you execute that for someone versus a child, but they roughly go back to the same basics of making that environment that is equal for them, and making an environment with prepared spaces where they can engage and really find that identity and purpose, and being able to participate in their everyday routine, especially with persons with dementia, and helping them facilitate, things that we might take for granted, like brushing our teeth, changing our clothes, taking a shower. It's really setting them up for success even in those settings.
Okay. So then what inspired you to integrate these Montessori principles into dementia care, and particularly in this intergenerational setting that you were in?
Yeah, I can't take credit for finding Montessori within dementia care. That is Dr. Cameron Camp. And I did my grad school project regarding the Montessori approach with Jennifer Brush, who was implementing it in a long-term care facility. But the Montessori, he founded it because his wife actually was a Montessori teacher for children, and he, through studies and peer reviews, found it to be an evidence-based approach to actually decrease challenging behaviors. So it is an evidence-based approach in the dementia facility, and it is used, the principles are still the same, but it focuses more on maybe visual signs, spatial design, and aspects to make sure that they're involved in maybe more of ADLs or activities of daily living than so for a child. But for the intergenerational piece in itself, that is Montessori already. The concept of intergenerational care is Montessori, because a big principle of Montessori is engagement in the community. and engaging. And that's one of the aspects of intergenerational care, and also giving each group purpose. So one group is getting purpose, being facilitators and teachers, and still telling them that they have something to give to this generation. And the kids are getting a grandma and a grandpa, but they're also getting, they're learning to live and interact. And they're also learning from these persons as well.
Yeah, I hear a lot about how both the older adult with dementia and the young children benefit from this approach. And in this environment, what were some specific, I guess, activities or tools that you found that were most effective when you were trying to engage kind of both of them, right? Because like you said, you're trying to get that play to their strengths and trying to get them to engage in a meaningful, purposeful activity that they both can do, right? And so what did that process look like, and what are some examples of activities?
Yeah, so it's definitely, with the center, it was with preschoolers and persons with dementia, and I would say that they were probably middle stage Alzheimer's or dementia. And to get, a lot of times we did a lot of meal prepping, but usually whenever we did an activity, right, we always only had out what was needed for that activity, because for both groups, having only what's needed for the activity, right, helps them achieve it and achieve it successfully. And also making a supportive environment for both groups around you. So whether that be pictures, step-by-step pictures, or step-by-step maybe reading instructions. We had a person that only communicated by reading. So making sure that we had those tools and environments for both groups. And with the kids, it was always pictures that they could follow. But that's a lot of times with the meal prepping, that was their favorite, because everyone can get behind eating food. And that's something, too, that it was easy to get both parties involved in. And that's where you saw a lot of the persons with dementia really taking that role and being a teacher to the kids and teaching them, how to put stuff on. Or we would make a lot of bagel pizzas or ants on a log meals, easy meals that you can, both children and persons with dementia can put together and do, right? Focusing on those abilities. Another big one was making flower arrangements for holidays, because that's something, picking flowers and colors, putting them together. They're not fine motor skills. They were great. Those are just some examples of what we did with both groups.
Yeah, I could definitely see. I did a very short, I guess not 1 year is not very short, but I worked at daycare while I was in college, and the preschool classroom, I'm trying to envision how, some of the activities we did with them, how they would be adapted or changed, I guess, to fit the needs of like the clients I work with who have dementia or whose family members have dementia. And it's really interesting. I think, I don't know that enough people have thought about how the two working together could really benefit them more so, I think, mentally and emotionally than physically, likely, right? But just from that mental, emotional, social aspect of it, I think I 100% see the value of it.
Mm-hmm.
I'm sure there were challenges that came up from time to time, especially when, again, you're trying to play to their strengths, but I'm sure every now and then, I like to think that development is pretty linear for children, but dementia is not very linear when it comes to progression in certain aspects. And so with, what were some of the challenges that you maybe noticed or I guess, had to manage? And then how did you address them, especially with balancing the needs of both the older adults and the young children?
So with the kids, it's a lot of times, they were kind of too young to really understand. They're just starting to understand that maybe a person, we called them rose room friends. One person would steal food off plates, and it's kind of de-escalating situations like that because they don't understand why an adult is stealing a roll off their plate. And so we would come into conflicts, but they quickly would understand after teaching them. It's a learning opportunity to teach them about dementia, and that we would read a lot of books, and there's few on the market, but that there are books out there that teaches a kid in a storybook way about someone that might have dementia. And we would do a lot of books like that so they would be aware. But a lot of the communication and just sometimes the misunderstanding that the disease might cause them to do something, not necessarily it's them. And that conversation is more difficult the younger you get with an age group.
Right, because that's also kind of the age group where they're learning how to share, right? Mm-hmm. And so then they're learning how to share. They're trying not to steal things from other people, but then they're witnessing adults doing it without understanding why.
Yeah, and a lot of times it didn't happen often. You tap into, especially with dementia, right? You're always the procedural memory. That's kind of the later thing to digress. And taking care and helping a kid, a lot of the times it would kind of it's like riding a bike. And that's where they got a lot of their purpose. You put those kids in a room and we hardly ever had agitated behaviors. Everyone was very gentle. And I think that is that's really set in their long-term memory, of taking care of kids, especially if they were parents, Yeah.
Yeah. What role did you find that the physical environment played in creating a successful Montessori ecosystem with the intergenerational format?
Yeah, definitely. Same as in both with the Montessori principles is clutter-free, creating a space that brings engagement. And so if they do wander, you're creating that space with tables and areas where they are free to be on their own and make an independent choice to do something in the building or in the facility, especially for both groups, allowing that independence. And having cueing signs was a big one for our persons with dementia, because a lot of them can read, but maybe verbally comprehending is hard for them. And a lot of people think, we were a nonprofit, and I would get, they would be angry that I was using the printer ink to make these high contrasting signs, but there is a reason for them. It's easier for someone to focus and engage on a high contrasting sign than something that's just kind of blending in with the background. So I always made these dark green backgrounds with white lettering as cueing, and I can make them myself. Anyone can make them on Canva. They sell them on Etsy as well. And that helped a lot, especially and the kids have fun with it too. And it also is a learning thing for kids as well, with reading and the pictures and recognizing items.
Yeah. Contrast is good for pretty much everyone, right?
Yes.
Even us. I mean,
yes.
There's a reason why stop signs are on bright red backgrounds with white lettering, right?
Yes.
There's a reason why yield signs are yellow with black on it. It's like contrast is always a good idea, especially when it's important.
Yeah.
If it needs to be read properly, So I think, absolutely. Now, I guess, so they come in and the kids and the older adults both participate in this approach while they're there. But was there carryover to home necessarily? Like, how did you train or educate families or caregivers on how to continue this approach or implement a Montessori principle effectively at home? And is it even appropriate for every family, or are there situations where it might not be the best option?
I think Montessori, it's a holistic approach, and I think anyone can create a Montessori environment, right? Creating that purposeful environment. And transitioning it to home, I really focus on creating the home for all. and creating in a space that everyone can thrive in. Maria Montessori started off, saying creating the home for the child. And it's just with the Montessori approach for dementia, it's just creating that home environment for all. And that's including them, right? And so they can be able to also participate in the daily home routines that they used to. I personally think it could thrive more in a home than what we see now, where it's more in adult days and facilities, because you are relying on caregivers and changing people and changing shifts and staffing and administrators to effectively make an effort to implement this approach. Whereas at the home, this person, and what better to implement a Montessori approach as a loved one at home, where it was intended from Maria Montessori for kids. I think everyone can benefit with it. It's the later you get in stages, you become more focused on sensory and still trying to give them choice through that way. Whereas in the earlier stages, you can still help them connect the dots with their procedural memory. And that's brushing teeth, changing clothes, making coffee, meal prepping, helping them make a schedule, a calendar, basically meeting them where they're at so they can still participate in their activities of daily living, very much like OT.
Yeah. Yeah. As you're saying this is all stuff that, I've seen implemented over my career in whether it's working with children or working with neurological impairments.
Mm-hmm.
And then, of course, going into dementia, a lot of what we talk about is those signs, the verbal cues, the visual cues, only putting what they need out on the counter. And that seems like it's very, very aligned there.
Yeah.
Can you discuss kind of how this intergenerational interaction is? Obviously, we talked about how it's good for mental, emotional health, but I can see where it could be very beneficial to older adults for their cognitive health too, and likewise the developmental growth for the children.
Yeah, I think, intergenerational care has shown, and there's many studies supporting that it actually decreases the decline of your cognitive health, especially with persons with dementia. It's, your brain is still a muscle. If you don't use it, you lose it kind of saying. And I think having those interactions really help someone, still have that engagement, still using their language, still using those communication skills, and still tapping into that long-term memory to teach or, to help, to engage. And that's a very different, and it makes sense, right, compared to someone who might just be sitting in a chair watching TV.
Yeah. Yeah. We've talked a lot about kind of the benefits of not just the Montessori approach, but also just intergenerational care in general. But as with all things, I always like to ask, because there's always two sides to everything, right? There's definitely people, there's naysayers in every aspect of every field for different things. What are some common misconceptions that you've heard from the general public, from people you've talked to, maybe even people who work in the field?
Yeah.
Misconceptions related to not just intergenerational living and care, but also the Montessori approach, maybe especially as it relates to dementia.
Yeah, I think with intergenerational care, I think a big misconception is, and what you see out there, especially with programs that are more structured, is with kids and older people. But intergenerational just means all generations. And I think it's just really trying to bring to light, still maintaining a community where a bunch of generations can thrive together, because we can learn and have fuller lives with that. In the Western community, you see, Western nation, you see 55 and older communities and nursing homes. So you really start seeing that isolation of older populations. And it's just really bringing to light the bigger picture of intergenerational care. And that bigger picture is creating communities for all, so we can all coexist, because there's benefits to a better quality of life that support intergenerational living. And with Montessori, I think the biggest misconception is that it's only meant for kids, or it's this approach that's meant for maybe dementia, or, people with memory loss, or you have to have a reason to use it. But a Montessori lifestyle is for everyone. So everyone can include in a Montessori principles in their everyday life.
Yeah. I like how you bridged those two kind of together, of how, Montessori is not just a program, it's a philosophy, it's a lifestyle, and you can truly embed it into your life at any stage, right?
Yeah. Especially, I think, oh, sorry.
Go ahead. That's
no,
okay.
I was just, I just popped in my head, I think about having a desk, and we talk about only having what you need out there. And I know my desk could use that, and it would probably help me focus on the task a lot longer if I only had what I needed on my desk. And and that's a big philosophy in Montessori, and an example on how it can be used in everyday life,
Yeah. I mean, it really comes down to, I think part of this is generational, but I find that a lot of our millennial generation, and maybe those middle to younger millennials, we have quite minimalist lifestyles in general, right? You see our homes that are not cluttered. You have very little things that are all around, and it's really funny because we have our kitchen has a million cabinets and a lot of cabinet space, which is great, right? Everybody loves that. But a lot of it is empty because I don't have to fill it. I don't have stuff that needs to be filled, right? And our parents will come over and they're like, oh, you have so much space, you should put this up there, and you should put this in here, I'll get you this. And we're kind of just because it's empty doesn't mean it needs to be filled.
Yes.
Right.
Yes.
Right.
And I do think that I think we will see too with the styles of homes. Before this podcast, I was just telling my friend, my mom has a lot of wallpaper in her house, and I'm visiting them in Michigan currently. So I'm at her office right now with the plain white, because, all the wallpaper is very distracting. And I kind of was thinking about that. And that's something that I have to think about now with a Montessori approach. How do you incorporate it if you're living in a very cluttered or a house that has a lot of wallpaper? And that is something that is a little bit of a challenge on how, to move past that barrier. Having a cleaner space just makes someone calmer and being able to get through the day, with reduced behaviors.
Yeah. I mean, I think even for neurotypical developing people, right, it's just overstimulating. Excuse me. It's very overstimulating when there's just so much going on, similar to you. My parents' home, they decided to repaint it I don't know, maybe 5-6 years ago at this point, maybe longer. I don't know. But they let my grandma pick some of the colors. And it's I walked into their house and the kitchen is pink. And then the dining room is yellow. And it's just it's so overstimulating because there's just so much in there.
Yes.
And then my husband's family, with the wallpaper and the bright colors and all of that. And I think maybe that was just generational to a certain extent. But then that has created this generational shift with their children where we're we want nothing on the walls.
I know. I think too with the nursing facilities, you want them to be homier too, but there is a fine line between too much and being able to create a space that they can focus, right? Because a lot of times in the terms of dementia, you need a clean environment. Isn't just because of personal preference. It's also to help someone focus, especially if you're using those cueing signs so they can be found. And I actually, advice I would give is having a big white sheet behind maybe the 5x7 card or the queuing card. So you can just create that focus for them in that environment if you do have a lot of wallpaper around.
Yeah. Yeah. Modifying the environment to kind of help, right?
Yeah. Because it's expensive to repaint your house.
Yeah, for sure. Those white backgrounds are not nearly as expensive as repainting the whole house would be.
Yeah.
But yeah, it just reminds me of just, even, this is kind of going off track a little, but like we had that whole Marie Kondo phase too, right? Of like, get rid of all the clutter at your house. And I just feel like it's all related. Like all of this is related on like feeling overwhelmed, overstimulated all the time. And how do you make your home truly your safe zone and your safe space to be able to just completely like relax and, be at calm. Which is, I find, and you might find this too, but I feel like with this, like my husband and I both work from home predominantly. And so it's like, this is also our workspace. And so it's kind of hard to juggle that between like, oh, we're so overstimulated and overwhelmed with our work stuff. And then this is also supposed to be our safe space and like calming area. And so we're really good about like, we keep work out of the bedroom. We generally try to keep work to our offices. But it's still,
I mean, it all ties together with Montessori, with the Montessori and creating those prepared spaces to really allow yourself to engage in that moment. And, I always say it's hard for someone to have anxiety or agitation when their hands are active. And that's like a big overall concept with Montessori for both kids and children and everyone. It's if you have engaged hands, it's hard to feel that agitation and anxiety because you're having purpose. Your hands are doing something. You're doing a task. You're doing something purposeful. So you're focused on that. Because behavior is not random. And sometimes the behavior is happening because you just don't know, you're getting that anxiety because you don't know what you should be doing. And it's helping you just create that focus.
Do you feel like then that, like taking a mental health approach, you mentioned kind of, and I agree with this to a certain extent of like, yes, when we're busy doing something, we often, especially as women, we're like, go, go, go. There's always something that needs to get done and we're always doing it. But the minute that we sit down and we don't have something to do, it's like, oh my God, I need something to do. I'm anxious. Like, what am I going to do? And I don't know. I don't know that is necessarily as healthy as it sounds because don't we need breaks? Like, shouldn't we be at ease taking breaks? Right.
Yes. And I think I like, because I am that person, but sometimes if, when we were little, we would make those French bracelets if you're a millennial like I am, or, do something with your hands. And that almost creates a calmness because it silences your brain because you're only focusing at the simple task. And it does silence your brain versus potentially sitting there and not having idle hands. And then that's when your brain is kind of going through the anxiety. I want to go home. What is she doing? Where's my husband? That's where all the questions start creeping in. But when you have those hands that are focused on something, they're more focused on the activity. Those questions that come in, especially with someone with dementia, they don't creep in as much because they're focused on the task at hand. So really it helps them have those mental breaks doing a task.
Yeah. Yeah. That's where those fidget toys really come in handy too, right?
Yeah. Yes.
Yeah. Earlier on, when we first started talking, you mentioned Monte Bloom. Tell me about Monte Bloom. What is it and how does it help families?
Yeah. So I focus more on families who are caring for a loved one in home. I really want to promote aging in place, and that's a fancy term just to say keeping a loved one home before putting them in a facility as long as possible. And I do this by helping you create a structure, a routine, a care plan, a personalized care plan, cueing signs, and going through all the communication specifics on how you can achieve a goal and reduce behaviors. And I focus more with meals, bathing, and leisure. So I find that those activities of daily living, when persons living in a home start having trouble with those eight specific ADLs, that's where they might look at a facility more. So I try to target, but I'm open to helping with any problem. I do consulting. I have an online course, and I just started an Etsy store, also called Monte Bloom, but that just offers resources that people can download, the signs and templates and care plans, and activity calendars, and they can adjust it for themselves. Everyone has a different language, I guess, and it's important to make sure that the person, when they read it, it makes sense to them. Soda versus pop is like a good example.
Yeah. Yeah. I'm originally from the East Coast, the Northeast. And when I first moved to Chicago, I would have patients asking me for pop, and I had no idea what they were asking me for. And then over time, I learned that they just wanted soda.
Yeah.
But yeah, it's the regional differences in wording too, which that's helpful. I'll have to check some of that out to see kind of what you've put together there. Now,
Yeah.
do you find yourself working hand in hand with other professionals like OTs, occupational therapy practitioners, or
Yeah.
PTs, or anybody else?
A lot of people who will join my newsletters I see are OTs and nurses. So a lot of professional people do look at my stuff. I just wanted to gear it towards caregivers because I felt that a lot of stuff is out there that's meant for nurses and clinicals with CEUs, whereas caregivers caring for a loved one in the home are kind of, either they can hop on those trainings, but they don't really have many options. So I try to gear it more towards them, but anyone can look at this stuff and use it, especially OTs. I think it's very beneficial for both. I would love it to be counted as a CEU maybe one day, but there's a lot of steps with that.
Yeah, there are. I don't know how CNEs are, but for nursing, but for OT and PT, and speech, I think rehab in general is very complicated to get
Yes.
CE approval. Okay, so you've you did a lot of work in that adult day preschool
Mm-hmm.
setting. And then since then, you've started your own practice here where you consult with families.
Mm-hmm.
Can you share a success story from a family or a community that
Yeah.
implemented that approach? Maybe it's the Montessori intergenerational model or just bits and pieces from your consulting work.
Yeah, so you go through a Bloom action plan, and that's just observing and creating a person-centered care plan and making sure that they have all the tools that they need and the right support tools for that specific person. But most of the time, the biggest thing that I found was the last person, they wanted more participation. Their loved one was actually pretty well involved. They went to the YMCA. They were in groups, they went walking, but at home, they were watching a lot of TV. But then when you start filling out my questionnaire, I learned that she can do ADLs independently. She makes her bed. She can take snacks that are left out. So really, that tells me that the person was able-bodied and can participate in more at home if maybe we just helped her out. So letting her do a meal plan and having her do a structured routine meal plan. She was a very routine person in general, but making sure that routine she can count on. This is what I do on Thursday. This is what I do on Monday, which is laundry, or creating a laundry room where she can participate in folding the clothes. So we got her off the chair. So not only is she involved with outside activities, she's also involved in her own care as well. So her daughter got some time away, some respite in the house, so she didn't have to do all the folding. Her mom was very able with the right tools, the right setup that she could complete and fold the clothes herself.
Yeah, that's really about just keeping someone busy and
Yeah. And giving them
engaged.
the space, yes, to do it, because no one likes to be told to do something or told they want to wash hands. But if you allow an environment where you have those cueings and you're asking in a polite way, they will do it. You're more likely to have someone do something if they read it versus being told by a loved one that they have to, because there's still, no one likes to be told to do something. We're all adults. And I think, that's the beauty of it as well, to allow, them to make that choice themselves with a little cueing.
Yeah. Yeah. One example that I have liked to give in the past regarding this is like even in the hospital setting. So I've worked in the hospitals for 7 years, and predominantly a lot of my patients have dementia or mild cognitive impairment of some sort. And, um, you know, they often will get a little delirious or just confused. And the go-to in medical settings is medical, or what do we call it? Medication restraint, right? A lot of times, and we did quite a bit of work around this. We meaning like the occupational therapy staff on like educating about the different things we could do to either calm someone down if they're overstimulated or get someone more stimulated if they're understimulated. Right. And one of the things was when we have those overstimulated people who like to wander and who want to just get up and do stuff, the hospital is not very conducive to allowing that kind of stuff, right? You've got alarms going off.
No, no.
They can't walk into other
Yes.
people's rooms. There's so many
Mm-hmm.
people. There are safety concerns. And so
Yeah.
we started like there was this one lady who, when we asked the family what home looked like, they said she's very active and she likes to do stuff. And so it
Mm-hmm.
got to a point where this woman was, every day just walking around the hallways, trying to go into people's rooms, trying to talk to people, and she just wanted something to do. And so we literally got like a linen cart, and was like, hey, would you mind helping us
Yeah.
with the laundry, please? Like, I could really use some help. And that just gave her something to
Yes.
do for a solid like hour of, and feeling like she was doing
Yeah.
something. And so it's like, yeah, at
Mm-hmm.
the end, and the linen cart didn't need to be folded. It was just sitting there, but it just gave her something to do. Right. And so,
Mm-hmm.
absolutely, at home, there's actually clothes that need to be folded and put away. Right. So, that's like a very active,
Yeah.
meaningful,
Yeah.
purposeful activity.
Yeah, and I think too, even I worked in long-term care and memory care units, and it's just, we have these activities directors and activities assistants, and, my job was creating activities, but it's, no one wants to just mindlessly put, balls in a bucket, but it's just amazing that the concept of, um, having someone be the person that puts milk on all the trays, and having, it's, you don't see that as much, but that's actually where the joy is, because it's not, yes, it's work, but it's work that is, it's a purpose. And I feel like I'm on repeat because I say that a lot, but it's really, it's true.
Yeah. Yeah. Well, I don't think any OTPs will call you out on being repetitive there because we do the same thing.
Yeah. Yeah.
I
Yeah.
remember when
Sometimes I'm like, I can't believe I'm talking about this. Yeah. Because it's just like, it's just, I just sometimes say, picture yourself. Like, do you like, would you want to do mindless activities, or would you rather do something with an end cause, and that's kind of, how most of us are, no one like sports. There's always an end goal on why you're running. I mean, there are some people that like to run just to run, but usually people run, to achieve a goal, and that it's the same for activities.
Yeah. Yeah, absolutely. I remember when we first met and talked, you told me about an app that you helped create that has a ton of resources around the Grand Rapids area. Can you tell us more about that, and what role does that technology play in supporting families who are adopting this model?
Yeah. So I was in my master's program and it was called Rethinking Dementia, Accelerating Change. And it was a initiative from a coalition. So there was a lot of investors with it. My task was to get all the resources in the area and compile it so a person's at home in the area could look up all the local resources such as respite, education, memory centers, primary care doctors, you name it, it was on there. And I think the big initiative was to just spread the word with resources and support because we started, especially in Grand Rapids, is seeing the same circle. Um, Always around with these meetings and conferences, and we realized we were not getting into the homes as much as we needed to be.
Gotcha. I think I'm going to backtrack a little bit because we talked a lot about respite care,
Hmm.
and I'm not sure that everybody knows what that is. So
Yeah.
let's talk a little bit about respite care and how one it what it is, and then two how the intergenerational living model can incorporate it and why it's important.
Yeah, so respite care is taking the time for yourself where you can mentally check out and take that break and do something for you instead of caring for a loved one. And they have a lot of adult days, they like to call them, in the community where you can put your loved one in a facility where they're taken care of by nurses. Maybe a doctor will be there or a CNA, and for a half day or full day or how many hours they're taken care of. Well, you can go out and maybe go out to eat, get some sleep. You choose what you do with your time, but that is the whole concept of respite care, and it's just allowing you to age in place, allowing your loved one to age in place, because you're allowing that time for you to keep going. Caring for someone at home is very hard. And that's the whole initiative Adult Day, is to allow you to continue to do that. But realizing that you do need a couple hours a day for yourself. So it's a beautiful concept. And especially in the US, they have Medicaid waivers for people who want to get their feet wet for adult days. So they can look in your state and look up Medicaid waivers, and you don't have to have Medicaid to participate. If you have private insurance, it's a smaller copay, but you can also ask your Alzheimer's Association chapter, and they can also direct you to adult days and potential options where they have those waivers as well. And it's just to get your feet wet. And if you have Medicaid, an option where you don't have to pay and you could get so many days to have some respite. For intergenerational care, there are intergenerational respite care options. I talked about the adult day where I worked at, where it's attached to a preschool. And there are options like that around. There are websites. Generations United is one in the United States where you can look at and find intergenerational respite cares around you if you really want to incorporate intergenerational care in your dementia care.
What was that website that you said to look into?
Generations United. So it's a bigger website, and you can look up in your area where intergenerational locations are, or
That's
intergenerational programs.
That's pretty cool. I'm going to have
Mhm.
to check that out. I'm curious. We have in the US so many regulations around childcare and elder care.
Yes.
How does that work when you have two together?
Yes. I'm glad you asked. So it depends on the state. So in Michigan, where I worked, adult day regulations are more lax. So you can easily attach an adult day onto a preschool. I would say it would be a lot harder to have an adult day and go through the hoops to attach a preschool onto that. There are rules and regulated. I work in quality with the state in California. So there's a lot of rules and regulations in California. And especially depending on the adult day. So if you have CMS money, so Centers of Medicaid and Medicare money coming into your facility, you're going to go through a audit, a survey, and the same goes through the preschool. We were only a social adult day, so that was a lot easier because we did not, in Michigan, there's not state surveys if you're not getting money from CMS, so Centers of Medicaid and Medicare Services. So we really just had to focus on being NACE accredited for the preschool side and following CDC regulations and guidelines for them. So it is separate. So that is a battle. And that's why we had a director for a preschool and a director, which was me, for the adult day. Because it is a different world. And when you find people in leadership, it's hard to find someone that has both. So I loved having a person that was a director for a daycare because she made sure that we were up to snuff on that side.
Yeah.
And I focused on my side. And I would say it would be a lot for anyone to do both.
Yeah, I was very curious about that because, I think Illinois is a little on the stricter side on both ends, probably. And so it's really interesting.
Mm-hmm.
It would be very interesting to try and meet both regulations effectively.
Yes. And it was a lot of weekly meetings.
Oh, I'm sure. Yeah. What advice would you give to a family considering a transition into an intergenerational living arrangement with or without a Montessori approach?
I would say that it takes, at least 4 weeks to really see a routine or schedule adjust. And I would say to be patient with that because it does take an adjustment with it and creating that routine. But the biggest thing is to really focus on a routine that everyone can stick with, and you try to stick with that and not change it up. So once you kind of make a schedule and a routine that the whole house can live with, really sticking to that because that's going to help your person with dementia living in that home be able to thrive. The rest of us could maybe be a little bit more spontaneous or not have to stick to the routine as much, but you're doing them a service if everyone can have a routine in place and understand that routine. And then that you'll decrease the arguments in the house. So if everyone knows the routine and understands, at this time there's lunch, then it helps them be able to be calmer and the whole house is calmer.
Yeah. As we're wrapping up, Annie, what is one takeaway you'd like the audience to consider as it relates to intergenerational living, creating a Montessori ecosystem?
Mm-hmm. The biggest thing I would say is to go with the flow for every activity. So as long as they're happy and there's decreased, agitation, and you're achieving that goal, they don't have to do it perfectly. And I think that that's something that all of us have to work on, especially when we set out this cute activity or this nice table and we have the cute queuing sign and everything's perfect, but they're just not doing it how you thought they would. And that's okay. They're happy doing it their way. And it's just, you just be, you're grateful that they are feeling purposeful and you're getting a couple moments of not having to entertain, right, or answer questions or deal with a reduced behavior. And I, even now with a kid, I have a under 2-year-old, I'm learning that with him to just let it go and they're going to do it their own way. But as long as they're safe about it, you're doing the Montessori approach correctly. Yeah.
Safety is always the number one key, right? And then everything on top of that is go with the flow.
Yes.
Annie, thank you so much for joining me today. I definitely learned quite a bit, and I hope our audience will too.
Yeah, thank you for having me. Excited to be here.